Okay, we are recording. So welcome to week 8. We have a lot to cover today. We have actually 8 chapters. Yesterday, I think I only got through 6 of the chapters, but we'll do our best. So quick question, just by a show of hands, or if I seem distracted, I'm just letting people in, but I'm paid. Show of hands, anybody take a look at any of the chapters we're covering today? Do you guys know what topics we're covering? Anybody have a chance to look at the PowerPoints? Let's see, Teresa is the only one waving at me. Okay, anybody else? Okay, so this would be a lot of information today for you guys. Anybody had a chance to look at exam 3 study guide? Okay. Anybody compare last week's information and kind of cross-check it, cross-reference it with the study guide? Okay. Cool. So if you're doing those kinds of things, you're in good shape. If you're not doing those kinds of things, it's just extra, it's just going to be extra work for you, because I believe there are, let's see, 8, and we did 5, so it's 13. So we're covering 13 chapters on exam 3. So, like I said in my announcement a couple of days ago, for people asking for tutoring sessions, I am so happy to accommodate that, but I need you to do your part as well, which is reviewing the 13 chapters, reviewing the study guide for those chapters, and let's see where let's see what your needs are. Okay, because your needs can't be 13 chapters. It has to be, what you don't understand, right? What you need help understanding, what you need help, what doesn't make sense to you in this, in the lectures, in the last 2 lectures, what doesn't make sense on the study guide. If things don't make sense in lecture or on the study guide, since we're just covering an overview of each chapter, each topic that we cover in the outline, you go back to the chapter and read that section in more detail. Okay, does that make sense? So to try and get through 8 chapters, I'm going to cover the study guides, the PowerPoints today, and point out in the PowerPoints what information in the PowerPoints is key learning to understanding the topics, the chapters, the concepts. Okay, and then it's up to you to go back and look at the book and find those areas in your chapters and go back and review those, right? And then after you do that, then you go to the study guide. I mean, technically after today, everything on the study guide should be at least identified as a topic, right? Or a concept. Okay. So that's what I meant when I sent that announcement, that I'm happy to meet with anybody who wants individual tutoring, but I need you to break it down as to what areas you need to be tutored in. Okay, because this exam covers so much, I'd like to try and wean it down as to what you need help with. Does that make sense? Okay. Second is, I did receive a couple of emails this morning that the Kahoot activity for levels of prevention wasn't working. So I have resent out a new link, and I've heard from a couple of students that it is working fine. Okay. I've also heard from a couple of students that these are really, really, really good. Has anybody had the chance to review either one of the Kahoots on AdPi or levels of prevention? Misty, you're the first one I see waving. Samantha, give me your feedback. Were they helpful?
I feel like the Kahoots are always helpful for me. Like I noticed that the first exam I took, after I reviewed the Kahoots, my grade went up like substantially. It was crazy.
Okay, that's excellent. Everybody hear that?
Yeah, I don't know. I think it's like the colors and the pictures for me that like help me
Okay.
understand it better, I guess. I don't know.
And Misty, what's your feedback?
Well, I really like the primary, secondary, and tertiary prevention one. It helped me a lot with that.
Good, good, good. Anybody else have the chance to review either one of them or both? I would highly encourage you to use that resource. I realize that Cahoots are meant to be a group activity, break up in teams and competitive and all that. However, there's just no time. There's just no time in class to go through those. And even if you can get through them individually, think of it as like a pop quiz, right? Or a exam review. I would use those two Cahoots in addition to your study guide. So I would highly recommend that you take a look at both of those. Very, very, very helpful. It's a very good review. I would say that going through those Cahoots is as, I think, beneficial as going through the case studies for each chapter. Okay. So nobody else other than Misty and Samantha have gone through those. Is that correct? Okay. Everybody, I'm going to just share my screen here for a minute. Everybody has got the, let's see. Everybody has got this. Nope, not that. Oh, wait. Maybe it was that. Nope. Let me go find it on here. Review. That's what I want. Everybody got the review sessions, right? Everybody knows when the review sessions are coming up this week, right? I need a yes. Yes, no. Everybody?
Yes.
Okay.
Yes.
Okay. I want to make sure everybody has it. Because I had a few students with exam 2 saying they never received the review schedule. So I just want to make sure I've sent it out to this group, which I'm pretty sure I have. So as you can see, there's one Thursday, Friday, Saturday, and Sunday. Okay, we try to accommodate 4 days. So, if you work on the weekends, maybe you can try and get to one Thursday or Friday. We're just trying to spread it out so you have every opportunity to attend. Okay, and as I get recordings, I will post them in the announcements. Okay, so you have 4 live and 4 recordings. Okay, and so like I said at the beginning, if you go through all your chapter notes, if you then go through your study guide, if you then use the additional resources I've sent you, the Cahoots, I sent after this class, I'm going to send you an additional Cahoots. So you'll have 3. And one is the one I'm going to send today. I didn't want to confuse you and send it before class, because if you haven't prepared for the class, then the Cahoots is not going to help. It's probably going to confuse you. But one of our instructors put together a week 8 Cahoots, which takes all these chapters in together. And she did one Cahoots for all of them, all the chapters. So I'm going to send that to you after the class. Okay, so review your chapter, your lecture notes, review your study guide, then review all 3 Cahoots, which is the week 8 summary I'm going to send you. You already have ADPI and levels of prevention. Okay, and then try and attend a review session or 2 or 3. And then if you can't, listen to some of the recordings. And then after you've put all that together, if you're still having trouble understanding any piece of information, any topic, any concept, anything, that's when I want you to schedule a tutoring session with me before the exam. So does that sound like a plan? Does anybody have any feedback or have any input feedback to that? Is that fair?
Yeah, that sounds pretty good.
Does that sound okay?
Yeah.
What do you guys think? Other than
Yes.
Samantha, what do we got? So I need you to do your part as well. Okay, I'm happy to tutor anybody and everybody, but I need you to do your legwork as well. Okay?
I'll like watch the videos, and then if I have like questions about it that don't get answered, I just write them down on a separate piece of paper. So
Okay.
it makes it a little easier,
Yeah.
I guess, to remember.
Yeah. And, use a study guide, just circle something or highlight something, take a highlighter and highlight what parts of the study guide you're just not getting. Okay. And we can go back and cover those. But first, if you take those parts of the study guide that you feel like you need a little bit more information with, take that and go back to the book and find that chapter, find that section, read through that section, and let's see if you can get a better understanding by reading that section, and then come back to me if you still don't understand it.
I'm sorry, it kicked me out. My phone went into safe
That's
driving
okay.
mode.
No worries.
Sorry.
No worries.
Okay.
No worries at all. Just gonna, yeah. And then the other thing I want to show you for today is exam 3. The green is what I was doing with my group yesterday. Okay, so, oops, did I share my screen? Can you guys see that? Oh, hang on. Share screen. Okay, so yellow was from last week. Okay, we did that last week. And then I went through and highlighted the other chapters we're going to cover today in green. Okay. So here's what we're going to cover today. We're going to cover ethics. We're going to cover cultural influences, case management, disaster management, surveillance outbreak, program management, and management of quality and safety. Okay. So again, the study guide is an excellent representation of the key areas of knowledge that we expect you to know to be able to support the topic or the concept. Okay. So everything's in green. I did go a little bit further in this chapter when we got to surveillance outbreaks because there were so many definitions. So we'll go back to that. Okay. Alrighty. So since we're just going to cover PowerPoints today, so we can get through the information, I'm going to point out in the PowerPoints what should be in the study guide as well. Okay. Please go to each chapter in the book and review the levels of prevention and the Healthy People 2020. Okay. Actually, we might go to each chapter and review those 2 particular points. So let's see how we're. You can review the objectives on your own, but if you haven't taken a minute to look at any of the PowerPoints, I'm going to try and go through them quickly so I can help you identify the key areas that we need to know. Okay, so why do we have ethics in nursing? Can anybody answer that for me? Why is ethics so important to consider as part of our nursing practice? Forget community health for a minute, just in general. What is ethics? Why does it play an important role in our profession?
Protect the patient.
Mm-hmm. What else?
Harm.
Mm-hmm. Mm-hmm.
So that people are treated equally and fairly.
Say that again. Yes. Treated equally and fairly. Is that what you said? Yep.
So that people are treated equally and fairly.
Mm-hmm.
Yes.
Mm-hmm. Yep. Yep. Ethics is built into every part of our life. Would you agree? Ethics is built into our daily decision-making, our daily activities, right? And so we have to be able to think about ethics and how we practice. Okay. And like this introduction says, ethics is more than being a good person. Okay. Basing our actions on ethical principles is part of clinical decision-making. That's really important. Basing your actions on ethical principles is part of clinical decision-making. Okay. Okay, what are some ethical decision-making frameworks? Okay, problem-solving processes, right? What guides are we using to make our ethical decisions, and how can they be morally justified? All right, remember that when all is said and done, we're making our own decisions based on what our values and beliefs are. Okay. right? We're going to be identifying ethical issues and dilemmas. They're going to be in every part of nursing, wherever we go in nursing. Ethical issues are going to be part of our practice. Okay. Okay, what are some ethical issues and ethnicity conflicts that we might face? And again, remember, these PowerPoints are outlines. Okay, to get a more detailed summary of what these topics are, you need to go back to the book. Situations in which ethnic diversity can be judged to cultural standards, right? Situations that place people at direct risk of harm, whether psychological or physical. All right, situations where ethnic cultural standards conflict with professional standards. Somebody give me an example of that. Where ethnic cultural standards conflict with professional standards.
If someone needs blood and they culture,
Excellent, excellent
doesn't.
example. Excellent. I think of immunizations being in the from the school nursing. What do you do when cultural standards conflict with professional standards? Our goal is to have all kids immunized, right? So situations where the greater community's values are jeopardized by specific ethnic values. Situations where specific ethnic community customs are annoying but not problematic for the greater community. So does anybody have any specific examples for right now of ethical issues that they've dealt with in their workplace? Anybody?
Of what kind of issues?
Ethical? Ethical. That's what we're talking about. Ethical issues in your workplace. Give me some examples of what you've dealt with.
Definitely probably like how they allow patients to like hurt the nurses and stuff. Like neglect and abuse of the caregivers. That's kind of overlooked a lot. And
Right.
then there's a lot of unsafe patient ratios.
Exactly. That's a
that
great
can,
example.
like, I don't know. I just feel like a lot of the health industry right now is like not focused on care of
Mhm.
patients, and it's burning a lot of us out because we're like the ones that aren't doing it for the money are overworked. You know what I mean?
Mhm. Absolutely. Absolutely. That's a great example. Okay, thank you. As we get to slide 10, we start to talk about theories and principles. And we're going to need to know that for the next exam. There is a nice summary in your study guide that we just talked about of your, where's my ethics? Right here. Okay. There's an excellent study guide right here, part of your study guide in the ethics and public ethics section. Okay. That talks about your theories and your principles. And they're right here. Okay. And I've highlighted just the word. Okay. But these are definitions. Okay. So our ethical principles revolve around, theories, utilitarianism, that the theory is that it's the outcome. So the actions must justify the means. And I'm only jumping back to the study guide because it's a really nice summary of each of these theories. And you may be asked a question about, given a scenario and said, which ethical theory does this fit in with? So there's 4 of them: utilitarianism, deontology, distributive justice, and consequentialism. Okay, so we need to know those 4. And again, if you haven't done a lot of prep work for today, I'm going to ask you to go back and look up these definitions. And then we have ethical principles. Okay, and here's the 4 we talk about: feminist ethics, virtue ethics, non-malfeasance ethics, and care ethics. Okay. What do you think about when you think about non-malfeasance? Do no harm. Okay. So there's a good definition, good section for definitions of ethical principles. Okay. And we just did this right here. Okay. Some other ethical principles are respect for autonomy. Okay. Respect for autonomy. We talked about non-malfeasance, beneficence, always do good. Distributive social justice. Are our resources distributed fairly and ethically? Okay. Feminist ethics, that's part of the study guide. That's one of the principles. So you'll need to be familiar with feminist ethics. Ethics and core functions. Okay. These are the three core functions. Forget ethics here. The three core functions of public health for nursing are assessment, policy development, and assurance. Okay. And then when you add ethics into looking at these core functions, what do we add? Okay, in the assessment, we add the virtue ethics. What is your moral character? Do no harm. If we're participating in policy development, achieve public good, service to others. And then if we're focusing on the assurance part of the core function, of one of the core functions, all persons should receive essential personal health services. Okay, so this slide is just adding the ethics scope, point of view into the three core functions, but this will never change. These are the three core functions of public health nursing. Okay. Then we have what is Public Health Code of Ethics. There's 12 principles. I'd like for you to read that. Okay, you don't need to memorize it, but I'd like for you to read through it. Okay, contains 12 statements that address the moral standards that delineate public health values, goals, and obligations. And these 12 principles are a summary of this whole entire chapter. Okay, 12 principles incorporating ethical tenets, preventing harm, doing no harm, promoting good, respecting both individual and community rights, and so on. Okay, one of our roles as a nurse when we're working in the nursing profession in general is advocacy. Here, this slide 17 focuses on advocacy and ethics. Right? Well, how do we advocate? Using ethical principles, right? Public health nurses have a moral mandate to establish ethical standards when advocating for, whether it's advocating for clients, advocating for healthcare policies, advocating for access, your three core principles. Okay. Okay, here is our chapter 4. Okay, let's go through the couple of things that I want to pull out for you to understand, which is at least the levels of prevention and the Healthy People 2020. So again, this is chapter 4. We are on page are we on? 52. Okay, so I'm going to scroll through here. You don't need to know. Here's your whole section on ethical theories, starting with utilitarianism on page 53. Okay. Here's your ethical principles. Remember this is our second question for our attestation. Okay, so somebody remember that for the end of class. Respect for autonomy, non-malfeasance, beneficence, distributive justice. There's an example, definition of each of them. Okay. This has a lot of good boxes, a lot of good information in here. Here's virtue for feminist and ethical theories and principles. So there's everything about feminist ethics right there on page 56. And more information here, still on 56. Okay. And here's our 3 core functions: ethics and core functions: assessment, policy development, and assurance. So this section talks about how you apply your ethics standards with these 3 core functions. Okay, your Healthy People 2020, here it is, page 58. So I need you to review that. What are the 2 objectives related to access? Okay, and access is your 3rd core function, which is assurance that people have access to care. Okay, here's your code of ethics with the 12 standards. Okay, public health code of ethics. Okay, there it is right there. Okay, simply summarized for you very nicely in box 4.3. This is a summary, this entire chapter right here, box 4.3. And then let's go through our levels of prevention. Okay, students are still getting these questions wrong on exams, so I want to cover them. So these levels, this box is related to ethics. So primary, why would use the code of ethics of nurses to guide your nursing practice? Why is that primary? Why is that primary? What is it doing? If you are using your code of ethics for nurses to guide your nursing practice, you are trying to prevent any problems, correct? Because you're educating yourself on the code of ethics to guide your nursing practice. So it's more of a prevention, right? If you're operating within the scope of your code of ethics, you're trying to prevent any problems, correct? Does everybody understand that? Everybody's quiet, which is fine, but do we understand that?
Yes.
Okay, so let's go to secondary. If you're unable to behave in accordance with the code of ethics, we take steps to correct your behavior. You could explain to your patient your error and apologize. Why is that secondary? Remember, secondary, don't just think screening, you have to think beyond that. Early identification, early intervention, right? So here in secondary, we're potentially identifying somebody who has made a misstep, right? So we've early identified it, right? And tried to correct it, right? You could explain to the client your error and apologize. So you're trying to prevent it from going any further. Just like you would do a health screening at a community fair and you're screening for blood pressure. You're identifying people who potentially are at risk for high blood pressure and getting them treated or giving them the resources to get treated so it doesn't go any further. Right? So early identification, early intervention. This is an excellent example of that. Do we understand? Do we have any questions or need clarification? Okay, tertiary. If you have treated a client or staff member in a way that is inconsistent with ethical practices, seek guidance on other choices you could have made. So this to me sounds like a person that is not understanding or working within the code of ethics. Okay, so now the issues have already happened. Okay, now we have to get some help for this particular staff member for how they can, what's the word I want? How they can update, that's not the word I want, but how they can, somebody help me with the word, rethink the way they're practicing. Okay? Does that make sense? So again, this is taking your levels of prevention and trying to think about it in a way that has to deal with ethics. Okay? All right. That's all I'm going to talk about with ethics. I think we have, let me just double check to make sure we have covered. National Research Act. You can look that up in the book. But just as a summary, National Research Act established the National Commission for the Protection of Human Subjects, okay? And it outlines ethical principles to be followed. So part of the National Research Act identifies 3 ethical principles that need to be followed: respect, beneficence, and justice. Okay? So you need to know about the National Research Act, our theories, and our principles. Okay? Okay, the next subject, or the next chapter we're going to cover is cultural. All right, which is right here. Okay, so let's go to that first. Go. Are you guys with me? Okay. So we are talking about cultural influences in nursing community health. This is one of my favorite chapters to cover in the whole course because it talks about why it is important for us as nurses to be culturally competent in our care and practice. So I will push that question out to you and ask, what does cultural competence look like? And what does cultural incompetence look like, and problems it can create? Why is it critical that we are culturally competent in our care? So fire away. I don't want to call on people. I really don't. So speak up, please. This is really important.
We have to respect their culture and beliefs. Just because we do it one way doesn't make it right.
Excellent. Thank you. Others? Okay. Here's one reason. United States population is becoming increasingly diverse. Okay, in every part of nursing, wherever you work, it doesn't matter. If you're in the hospital, clinic, community, rural, you are going to be challenged with different cultures. Okay, different cultures, different beliefs, different values, different languages, different practices. So you need to be moving towards cultural competence to be able to effectively provide care, right? Nurses and clients often come from different cultural backgrounds and may not recognize or understand the differences, right? Nurses must be able to provide culturally competent care. Okay, the 2 things we focus on in this chapter, the 2 groups, are immigrants and refugees. And there's a difference. Okay, there's a lot of similarities, but there's a difference. Right? We know that legal immigrants, well, here's a slide on some of the immigrant categories. We have our legal, our refugees, our non-immigrants, and our unauthorized immigrants. Okay, typically when we talk about immigrants, they're here in the United States. Sometimes they're here to work. Sometimes they're here permanently or temporarily on work visas. Okay. Refugees are different. Refugees are admitted outside, and they've usually come in for, I don't know, war-torn zones, fear of persecution. And I'll show you where that is in the book, but important to recognize the difference between an immigrant and refugees and what kind of care we need to prioritize for them. Okay, so 6 is an excellent summary of factors to consider when providing health care for immigrants. So if you're presented a scenario on an exam, it could be an immigrant or it could be a refugee. You're going to have to be able to determine, what group of people we're talking about. So here's some factors to consider that you can review on your own. Slide 6, factors to consider for providing health care to immigrants. What's the definition of culture, race, and ethnicity? Here's a summary of that. What's cultural diversity? We all know what cultural diversity is, right? Degree of variation that's represented among populations based on several things: lifestyle, ethnicity, race, interest, place of origin. And then here's my favorite. It's my favorite slide of the whole class. Cultural competence. Okay, combination of culturally congruent behaviors, practice attitudes, and policies that allowed nurses to work effectively across cross-cultural situations. And there's 4 principles to cultural competence. And these are them right here. So we're on slide 9. And I love this slide too. Key reasons nurses must be cultural competent. That's what I asked at the beginning of class, or beginning of this chapter, right? Because often our culture differs from that of clients we're taking care of, right? That may lead to different understandings of communication, behaviors, and plans of care. Right? Non-culturally competent care may increase the cost of healthcare, decrease the opportunity for positive client outcomes, and much, much more. And we'll go to the book and look at healthy people. How do we develop cultural competence? Okay, we're going to look at that in the book real quick. Concepts of cultural competence. Well, we need to have an awareness, a knowledge, a skill, maybe have done an encounter with a specific culture, and we have to have the desire. These are all significant if we're going to work towards cultural competence, and that's with any culture. Have we taken the time to become aware? Have we taken the time to become knowledgeable? Have we taken the time to learn a skill that's part of their culture? Okay, and then the dimensions of cultural competence: preservation, accommodation, repatterning, brokering. Show you where that is in the book. And then what are some barriers to developing cultural competence? This is for us. What are some barriers? Stereotyping, prejudice, racism. Are we culturally blind to a certain culture? Are we not able to recognize a cultural conflict? Are we in cultural shock based on certain practices in cultures? Okay, so how do we do a cultural nursing assessment? So this would be the equivalent of how do we do a community assessment? How do we do an environmental assessment? How do we do a safety assessment? How do we do a cultural assessment? Here are some of the things that we need to find out. Okay, again, this is part of our culture assessment. So slides 15 and 17. Take your ADPI, take your A from the ADPI and describe the A in cultural assessment. And then I'll show you a nice little summary in the book of cultural group differences. Although all cultures are not the same, all cultures have the same basic organizing factors where what is their communication style? What is their space preference? Do they not like you in your face, or do they like you in your face? What's your social organization, time perception? Are they past oriented, present oriented, future oriented? What's their nutrition? What's their, I'll show you in the book, we have 4 different cultures we talk about, and it goes through each of these. Very interesting. Okay. And then here's 5 principles of culturally competent organizational models. So this would be in your workplace. Does your workplace value diversity? Do the staff do cultural assessments? Right? Do they understand the dynamics and difference of providing care to different cultures within your institution? Right? Does your institution encourage cultural knowledge of different cultures? And do in-services or education or programs about increasing your knowledge for diversity? And are you encouraged to adapt to diversity? Okay. So here I am at page 65 with chapter 5, cultural influences in nursing and community health. We just went through all this. That's your outline. Okay, so let me see what I highlight in here. Here's your immigrant health issues, page 66. And it also talks about refugees right here on page 68. Okay, the thing you need to know about refugees and how different the significant difference is, think of where they came from. Okay, they may have left their homes as a result of disaster. All right, this might have, or war might have led to physical, psychological consequences. Many have been tortured. Others may have lost family members in horrible ways. All right, so they may need a different approach to care when they first get here. One of the priorities they need when they get here, and this is one of the big differences, is is therapy, psychological therapy, okay, depending on what they've been through. Okay, that's a key difference between refugees and immigrants. If you're coming in as immigrants, you may need help on sorting out healthcare as a priority, or sorting out transportation or whatever. But the refugees, they're coming for a whole new reason. Think of the groups just in the last year that we've accepted as refugees here in this country and what they've come from. I think first thing I think of is Afghanistan. Think of what those people are coming here to escape. Okay, so you need to know the difference between those two. And then this is a section that talks more in depth about culture, race, and ethnicity in each section. Culture, race, ethnicity. What is cultural diversity? All right, we talked about that in one of our slides. Okay, so here's the table I wanted you to be aware of, is table 5.1. What are the cultural variations among selected groups? We have 4 groups. I want to focus on these 2, Hispanics and Native Americans. So I need you to be aware of these different variations, and I've highlighted a few. So let's take verbal communication, for example. With the Hispanic population, part of their culture is any expression of negative feelings is considered impolite. Where with Native Americans, with regards to verbal communication, low tone of voice is used, and the listener is expected to be attentive. Okay, nonverbal. Hispanics, avoidance of eye contact is usually a sign of attentiveness and respect. Where Native Americans, direct eye contact is often considered disrespectful. So you may be presented a scenario and asked which culture, what identifies an Hispanic population with regards to time. Okay, so for example, Hispanic population with regards to time is often present oriented, but the Native American community is often past oriented. So what does that mean? Here's an example with regards to the Native Americans as a community health nurse. Let's say you have a Native American family who has had, I don't know, a family member who's had a heart attack, and they need to schedule cardiac rehab, and they need to schedule appointments in the future. If they're past oriented, do you think they might need some assistance with getting that task accomplished? Yeah, that's just a yes or no question. What do you guys think about that?
Yeah, definitely.
Okay. Perception of health, right? Hispanic, balance and harmony among mind, body, spirit, and nature. Right? And then with the Native American, you add in the emotions. So anyway, I'd like you to be familiar with that. Okay. Here's our levels of prevention with regards to cultural differences. And here we're talking about, they've brought up hypertension, stroke, and heart disease. So primary, remember, we're talking about cultural differences here. We're done with the ethics chapter. We're now into cultural differences. So primary, provide health teaching about balanced diet and exercise. Why is that primary?
Because it's preventing it from happening.
Yeah, it teaches and prevents.
Yep. If you're providing teaching about a balanced diet and exercise, hopefully you're preventing, I don't know, let's say obesity down the road. Secondary, teach clients and her family to monitor their blood pressure. Teach about diet, keep in mind the client's cultural preferences. Talk about health beliefs and cultural implications, such as the use of alternative therapies. Right? Make sure whatever you're suggesting for alternative therapies is compatible with whatever regimen they're on now. Okay, so why is that secondary? It's in the first sentence. Why is that secondary?
It's a screening.
Yeah. Right. We're teaching them to take their own, monitor their own blood pressure. We're asking them to screen themselves, early identification. Okay. And then tertiary. If blood pressure cannot be controlled by diet, refer the client to a physician or nurse practitioner for medication. Why is that tertiary?
Because it's already like an ongoing problem. So now you have to solve it.
Exactly. Blood pressure cannot be controlled, so they have hypertension. Now what? Okay. Okay, this is important to know as well. Socioeconomic factors contribute greatly to the understanding perceptions of health and illness among minority groups, right? So among minority groups, they may not have the opportunities for education, an occupation, income earning, property ownership to similar of those in the dominant group. Right? Socioeconomic status, which is a measure often based on income, education, or occupation, is critical in determining the access to healthcare and the development of some chronic problems and health outcomes. Was said this all along, how the socioeconomic factors affect access, right? In certain cultures, just don't have the education, the occupation, the income earning as others do. And then here's all about cultural competence. Okay, here's a healthy people related to cultural issues. There's 2 goals. Okay, page 74. Okay. And here's how we develop cultural competence. Okay, And we talked to, this is in one of your slides, cultural awareness. This just goes into each section in a little bit more detail. How do we obtain a cultural awareness? How do we obtain cultural knowledge? How do we obtain cultural skill? Cultural encounter. But that basically means are you, maybe you go out and you participate in a food fair or something in that particular family's culture, so you can have an encounter, maybe understand their culture a little bit better. Right? Here's an example: direct cultural encounters, when nurses learn directly from their Puerto Rican American clients about spicy food they should avoid when breastfeeding. Okay. And then how do we get our cultural desire? There's five areas there. Okay, and this is an excellent box, 5.3. Points to remember about developing cultural competency. This box 5.3 is pretty much a summary of this whole chapter. Okay, so please have a look at that. Okay, and then there was 4 culturally competent nursing interventions. I don't need you to memorize these, but I need you to be aware of what they are. Okay, and that is, and you can read about them: cultural preservation, cultural accommodation, cultural repatterning, and cultural brokering. And the first sentence in each of these each of these sections, the first sentence is what it means. So I'm going to rely on you to go back and get that. Okay. And then the last part of this chapter I want to cover is, what are some inhibitors to developing cultural competence? It was on a slide, but I would suggest you go back, and if you're unclear about what the definitions are about these barriers or inhibitors, come back here on page 78. What does stereotyping mean? What does prejudice mean? What does racism mean? What does ethnocentrism mean? Right? What's cultural shock? You may be provided a scenario in which there's a barrier or there's an inhibitor, and you have to identify what is it? Is this an example of stereotyping? Is this an example of racism? Is this an example of cultural shock? Okay. And then the last part of this talks about how to do a cultural assessment. Okay. And I think that the information provided on the few slides in the PowerPoint about how to do a cultural assessment is accurate. Not accurate is enough. There's enough information in those PowerPoint slides that I'm not sure you need to go back and review this section, but that's up to you. Okay. So let's go to, real quick, let's go to our study guide. Let's see if we covered. Okay. Okay, so here's our immigrants. Right, when working with immigrants, we need to consider several factors. Okay, so we talked about that. Okay, and then here's our little here's our paragraph on the refugees. Okay, so we covered that. Okay, and then the other part is that box we looked at, right, about Native Americans and Hispanics. Here we're talking about past oriented. Okay, and here I gave you the example of the follow-up, the Native American family who needs to follow up. They'll need some help. Okay, and here is the Hispanic community. I highlighted this in red because one of the students yesterday pointed out that this is inconsistent with what was in the book. When communicating, nurses should avoid using negative expressions. Clients who are Hispanic, direct eye contact. hang on. Let's go back real quick. I need to find out because I need to make sure we, okay. So let's find out, let's see. Avoid the use of negative expressions. Anybody can jump in here and help here, which is considered impolite. Okay, so it wasn't that part. I think it was the second part. Clients who are Hispanic, direct eye contact and physical contact during communication. Maybe it was that. Direct eye contact is often considered disrespectful. That's where it was. Okay. So Hispanics, direct eye contact. I just need to update this sentence. Okay. So it would say clients who are Hispanic or if they have direct eye contact, it's considered disrespectful. Does everybody understand that? So everybody write that into your study guide. Okay, and it's only, and we all use this, all the instructors use this, so I'm not going to change it now because I want to send this to all the other instructors, but red means I need to update the verbiage. So does everybody understand that? Yes, no, what?
Yes. So direct eye contact, they don't like, but they do like touch, correct?
Well, let's look. Nonverbal avoidance of eye contact is usually a sign of attentiveness and respect. So what I'd like to do there, oh, we're talking about Hispanics right now. So what I'd like to do is I'm just going to put this in here, which is the actual verbiage from, okay, so that's what it should say. So I'm not going to take this out yet because I want to make sure with the rest of the instructors I go through that, but this right here in parentheses is what I'm looking to correct. Okay. Does that all make sense? Does that make sense to you guys?
Yes.
Okay. All right. All right. So, all right. So we've covered that section. Anybody have any questions on cultural influences? Okay, let's go to chapter 13. How are we doing for time? Okay. So the next chapter we're going to cover is case management. What is case management? What do case managers do? I would assume that if you work in a larger institution, you work with nurses who are case managers or somebody who might be a case manager, maybe a social worker, a nurse, a discharge planner. What do you guys know about case managers? What do they do?
They handle setting up like skilled therapy and all of that stuff for us at the hospital, any outside appointments.
Yep. They're a coordinator of care. Case managers are coordinators of care. And often it falls to the nurse. And it may be with regards to discharge. There's a nice little list in the book of what kind of clients, what kind of jobs case managers might have. It might be discharge planning. It might be follow-up surveys to patients who have had triple bypass surgery, stroke patients. It might be there's lots of different ways nurses case manage, but it's coordination of care. So you might be case managing with a doctor, with physical therapy, occupational therapy, speech therapy, home oxygen equipment if they're going home, coordinating that kind of care. Okay. There's just some definitions that we don't really need to go through that right now. Right. So case management So case managers work in the case management system. It's complex because of the coordinating of activities of multiple providers, payers. That's the other thing. You might be working with insurance companies. All right, there's lots of different providers you might be working with. And it becomes more complex in the rural settings. And we'll go to the chapter and review the Healthy People 2020 about what their goals are for case managers. So what are the characteristics, roles, knowledge, and skill requirements of case managers? Okay. You can take a look at those. What are the tools that case managers might use? Advocacy skills for case management. The nurse advocates and helps the client make the right decisions based on the information they have, right? We're aiming to promote self-determination. What is that? What's self-determination? It's another word for self-determination. Autonomy, right? We're aiming to promote autonomy with our clients. We want them to participate in the decision-making, right? So what's our process of advocacy when it comes to case management? We want to keep our clients informed. We want to support them. We want to affirm them. We want to problem solve with them for the best outcome. What are some conflict management skills we're going to need in case management? Because everybody you're working with, there may be disagreements, right? If you're pulling together a big group of people for the coordination of care for whatever, an individual, a family, a community, everybody might not agree on what the plan of care is. So what kinds of skills might be helpful to have as a case manager? Negotiating skills, cooperation skills, assertiveness skills, how to work with people that disagree. And you just had two projects, two group projects that you just worked with your teammates. You know, it may have gone very well, but you may have worked with teammates that were, I don't know, less than helpful or didn't carry their weight, or and what kinds of skills and negotiation tools did you try to use to work with your teammates? It sounds like most groups worked brilliantly together, but I did have a couple of groups that weren't working well. And so I had to help work with them and educate them on challenging group dynamics. Collaboration skills. What kind of collaboration skills will a case manager need? Right? The goal is to promote respect, understanding, and accuracy of communication for all team members. You know, here's some needed knowledge and skills, right? What does everybody need to know? Everybody needs to be aware of the client, the health status, the resources, the treatments. Everybody has to be on board with all the information. And there's a reason we did 2 group activities. Okay, group work in nursing in general is always going to be there. You may not be labeled a case manager, but if you have a patient load on, say, a floor, you are case managing that patient, right? You may be working with, I don't know, depends on what kind of floor you're working. Say you're working on a rehab floor, right? And you have a group of 5 patients. You know, each one of those, the group you're working with on any given day may look different. Does that make sense? You may be working with PT or a discharge planner, PT, social work, home health, to try and get that patient moving forward to going home. Okay. And then there's issues in case management, like in every other part of nursing, legal issues, ethical issues, right? The one thing to understand here, we talk about liability concerns for case managers. You could also say malpractice. Liability concerns of case managers exist when all these 3 are met. All these 3 have to be met. The provider had a duty to provide reasonable care. A breach occurred through an active omission to act, an act or an omission to act. And the act or omission caused harm, caused injury or damage. And then there's ethical issues. And we go back to our ethical chapter, maybe issues of autonomy, beneficence, justice, non-malfeasance. There can be there's legal and ethical issues in every part of nursing, right? And here we're identifying it for case management. I want to go to the book. So we are in chapter, I believe, 13 right now. Okay, so we are in page 70, case management. Let's go through and see what we need to know in here. Here's your definition of case management, right? Coordinator of services. Here's our Healthy People 2020 box for case management strategies, page 224. There's 2 of them. Okay, so if you're asked a question about what are the objectives for case management, these are your only 2 correct answers. There may be other answers that sound great or make sense, but are they Healthy People 2020? Okay, increase the inclusion of clinical prevention and population content in undergraduate nursing, including counseling, training for health promotion and disease prevention. What does that mean? Increasing the knowledge base for student nurses so that once they get into the nursing profession, they are going to be expected to be case managers. How do we prepare them? Okay. This table 13.1 is an excellent summary of how we apply our ADPI nursing process to case management. Okay, so I want you to have a look at this: assessment, diagnosis, planning, implementation, evaluation. It goes through what assessment looks like with case management and what activities might be performed. Okay, so this is a good summary of applying your nursing process skills, not to just an inpatient patient, applying it into the community or into the case management process. Okay. And here's all, that was the box I was talking about. Box 13.2, nothing to memorize, but just looking at all the different roles a case manager may play. Okay. And in a rural community, you're probably doing all of these. Okay. So it just depends on what type of environment you're working in. You know, you may be doing 2 or 3 of these roles. You may be doing all 12. Okay, it just depends on how your case management program is set up. Is it inpatient? Is it outpatient? Is it in a large hospital? Is it in a small rural hospital? And then here's all the knowledge and skill requirements that was in the outline in your PowerPoint. I think. And then this is we need to know. What are some examples of case management conditions? So when you look at this list, what do they all have in common? 13.4. Think about case management. What do all these conditions have in common?
Seems like they're all high risk or severe.
Mm-hmm. Which will require what?
Case management.
Which is?
Out of hospital care.
Yep. Coordination of care. Right? So if you're a case manager on a spinal cord injury floor, who are you going to have to coordinate with?
Rehab.
Who else?
Occupational therapists.
Yep. If you work on a severe burn unit, Who might you have to coordinate with? Do you get my understanding? Maybe infection control, whatever, physical therapy. Same with terminal illness. Who might you have to coordinate care with? Maybe hospice. Right. So these are examples of case managed conditions. What they have in common is they are going to require multiple agencies or coordination of care with multiple departments, people. Does that make sense? That's the purpose of case management is identifying which particular groups are at high risk to need case management. Okay. And then essential skills for case management. We went through this. Advocacy. This again, another, we talk about advocacy in every chapter. Okay, this is an excellent summary, 13.2 on page 230, of how we think about the nursing process when we're thinking about advocacy. Okay, so for example, an assessment. What is our advocacy process in assessment? Well, we want to make sure we exchange information, gather data, talk about values. What about planning? Right? We want to generate alternatives, prioritize action. So this is an excellent summary of nursing process regarding advocacy. Because we get so caught up in the nursing process, the ADPI, kind of in the inpatient hospital setting. We have to be able to shift that out of the hospital setting. And that's what this is doing. Okay. Okay, and then last in this chapter, I want to cover levels of prevention. So this is related to case management, since this is the chapter we're covering. So let's figure out why this first one is primary. Use the information exchange process to increase the client's understanding of how to use the healthcare system and promote health and the health promotion strategies that will maintain health. Why is that primary? Anyone?
You're trying to figure out like what the background information is before you can implement anything.
Okay, that's part of it. But it says it right in the sentence. We're trying to increase the client's understanding of how to use the healthcare system, right? And how to use the health promotion strategies so that they will maintain their health, so they're not sick yet. We're trying to provide them education on how to utilize the system. Does that make sense? Do you guys understand that?
Yeah.
So by teaching them about the information exchange process that is available to them, we're trying to increase their understanding of how to use the system to promote health promotion strategies so that they can maintain their health. Secondary, use case finding to identify existing health problems in your caseload and the population. Timely holistic assessments and interventions can slow disease trajectories and promote health and healing. Why is that secondary? I'm going to wait. So why is that secondary? What are the key words in that make it secondary?
Assessment and intervention.
You're finding and identifying, you're trying to mitigate an issue.
Exactly. You're trying to, what do I say with secondary? Early identification, early interventions. So you're trying to identify any existing health problems, right? And we're trying to assess and do interventions that can slow the process, right? So you're trying to minimize the you slow the process. Okay, by early identification and early intervention. Okay, why is the next one tertiary? Monitor the use of prescription medications and adherence to treatment to reduce risk for illness complications. Why is that tertiary?
Because you're doing treatment.
Right, so whatever they have, it doesn't identify what they have here, but they have some kind of disease or some kind of challenge. So one of the tertiary preventions is maybe you're going into the home to monitor their prescription medications, right? Maybe they have started on something new and you're monitoring their side effects or their tolerance of the new medication. Does that make sense?
Yes.
Okay, and here I highlighted this section because collaboration is so important in case management. So if you want to read through that, that's great. Page 232. Okay, and again, this was the legal issues, liability concerns with case manager. You have to meet the criteria of all of these three in order for liability or malpractice to be in play. Okay, case managers must strive to reduce risks, practice wisely within the acceptable standards, limit legal defense costs to professional insurance coverage. And that's totally up to you, whether you seek additional professional insurance coverage. Okay, and then ethical issues. And you can read through that section because it potentially is an issue. You have to be following your code of ethics. All right, and there is a code ethics for case managers, as there is for school nursing, as there is for hospice nurses, home health nurses. Okay, and here are the ethical issues. It's a good summary of what beneficence is, what justice is, right? Beneficence is doing good. Non-malfeasance, doing no harm. Veracity, telling the truth. Okay. Questions about case management? I know this is a lot of information. Any questions on case management? Okay, disaster management in the community. Why is this important to have a plan, to understand disaster management? What role might we play as nurses in the community in disaster management?
Safety personnel?
Nurses participate in every part of disaster management. Okay, we may be part of the plan for prevention. We may be part of the plan in response, recovery. Okay, so the few things we need to understand about disaster management is, first, we need to understand that disasters are both human-made and natural. What's an example of a human-made disaster?
War.
A bombing.
Okay, yep. What is the, I'm just going to close a window here. What's an example of a natural?
Hurricanes.
Yep. Okay, that we know the cost to recover from disasters has risen sharply, right? We know that nurses are increasingly getting involved in disaster planning, responses, and recovery. Okay. We'll go through this in the, we need to know here what U.S. agencies are and what their goal is, because everyone is different. But we have 1, 2, 3, 4, 5 agencies. Okay. that we need to know what they do, and I'll show you where that is in the book. Healthy People 2020 with regards to disaster management, we need to be aware of. And here's our cycle. Here's our disaster management cycle. First, we have prevention. Okay. Preparedness. What is our role in preparedness? How do we prepare families? How do we prepare the community? Okay, here's our role in preparing. Okay, and I'll show you what section of the book I want you to review. Okay, the response. So something happens. Okay, here's a bunch of different scenarios. How do disasters affect communities? Physical and emotional effects, stress reactions. Here's some roles we might play in a disaster. Advocate. We may be doing assessments. We need to understand what community resources are available. And we're often the first responders. We're often assigned to shelters. What does that look like? Nurses working in shelters. Right? What might that look like? What might we be doing in shelters? That would be slide number 12. And then the next part is the recovery in the cycle, right? Recovery is about trying to return to the new normal, right? Often recovery is the hardest part of the disaster. And recovery involves the coordination of many, many agencies, right? To try and restore economic and civic life to the community. Okay. What might our role be in the recovery effort? Right? It may be as simple as teaching proper hygiene, making sure immunizations are current, referrals to mental health, assessing the risks of environmental hazards after a disaster. Okay. So I'm on the disaster chapter 14, page 236. Okay, and here's your natural and man-made, human-made disasters. So definition of them, and then here in box 14.1 is examples of each. Okay, natural and human-made. Yeah, you may get asked, you know, what a scenario of, say, earthquakes, and you have to identify whether that's a natural or is it man-made, human-made. Okay, so you don't have to memorize all these, but understand what the difference is between natural and man-made. Okay, so here's some definitions of some of the departments, organizations that will be key in participating in whether it's preparedness, whether it's actual response. So you need to have an understanding of each of these. Okay, and I've highlighted 4. Preparedness guidelines, response framework. 4 of them up here. PPD 8, NPG, NRF, and the emergency support function, which is the public health and medical. Okay, so that's 238. What's the cycle? 4 stages. We just talked about this: prevention, preparedness, response, and recovery. And we're expected as a community health, public health nurse that we should be able to participate in any one of those stages. Nurses have skills that enable them to work in all aspects of disasters, such as assessment, priority setting, collaboration, education, disease screening, with all of our clinical expertise. Right? We also have the ability to provide essential public health services. We can make referrals to whatever agency, whatever resource they need, because part of our role is triaging. We can do rapid needs assessments. Here's your goals. Here's your 4 Healthy People 2020 goals related to disaster mitigation. So if you get asked a question about Healthy People 2020 objectives related to disaster mitigation, there's only 4 right answers. Anything else may sound good, may fit in, you think it makes sense, and there's lots more. But these are the 4 specific Healthy People 2020 goals. Okay. And then it goes through each of the cycles, 4 stages. And the one I want to focus on right here is preparedness, because we're going to be part of that. All right. We need to help families prepare, how to be Red Cross ready. So let's really focus on this how-to box on page 240. Okay. Get a kit, make a plan, and get informed. So I'm going to ask you to review this, okay? Because getting families ready is the most important part of preparedness, right? Helping them put together a kit. What needs to be in the kit? 3 days of food. Okay, keep the kit accessible. Remember to check the kit every 6 months for outdated items, right? Make a plan. Where's everybody going to meet up? Does everybody know where the kit is? Does everybody know how to turn off utilities? Does everybody know where supplies are stored? Okay, so that's the 3 key parts. Get a kit, make a plan, and get informed. So I really need you to have a look at this box. Okay? And we need to be preparing for different types of disasters: chemical, biological, radiological, nuclear, explosive. Box 14.2, information only, nothing to memorize, but certainly important to be aware of. You know, even if you are not working in the community, if there's some kind of a disaster, the fact that you're a nurse, you may be asked to participate. Okay? And every one of your workplaces should have a disaster plan. And I'm assuming that every one of you participate in drills. I know we do that in schools, sometimes monthly, sometimes each semester, but it's a requirement now. You have to have a disaster plan. You have to do disaster drills. You have to know what your role is. I am crystal clear in the schools, or at least I was before I retired, crystal clear what my role was. And it was different in every school. But there were some schools, if I was in the building, one school I was assigned to a student that was a one-on-one. Another school, I was part of the incident command. All right, so you must know what your role is in a disaster. Okay. So the level of community preparedness for disasters only as good as the people and organizations in the community make it. All right, some communities stay prepared and do drills. Others, you know, aren't as prepared. And when something happens, you can, I'm always looking when a disaster happens, you can tell a specific, you know, a community or people that how well they've planned. Right. And we know that the planning and implementation require a coordinated response that involve many people. But we have to pull the community in to be participating in that preparedness. Okay. Anybody ever participate in mass casualty exercises? They're pretty intense. Anybody participate in one of those? We do it annually out at our airport with firefighters, police, first responders, hospital, tent hospitals, and we do a simulated airplane crash, or we do a simulated chemical warfare. And it's people from all over the Rocky Mountain region come to participate in this. Hundreds and hundreds and hundreds of people. Okay. Please know about this National Response Framework. That is the agency, the federal agency that kind of takes the lead on everything. Specific needs arising from a disaster. Okay, it does focus on short-term recovery, but it starts the process. Okay, it helps in the beginning to define the roles and responsibilities and the relationships that are critical to effective emergency planning. Okay. I like this, check this practice here. Let's say you were in a shelter working as a nurse and you were making sure people had their medication and making sure you were, triaging. Right. Let's say somebody from the media came in and said, hey, how's everything going with this disaster? Can you give us an update? Do you speak to the media and provide them information, or do you refer them on? And who do you refer them to? And why? Why would you not be the person that they need to talk with?
Because you don't have the whole information about the emergency.
Exactly. And so what might you do?
Direct them to the person in charge.
Correct. So remember that. Okay, just because we're part of the triage team in a shelter doesn't mean that we go on and talk to the media about the response of the disaster, because we're only one little part of it. Okay. Tips for survivors of a disaster or other traumatic events. How do you manage stress? Okay, this is for survivors, but this can also be us. Right? So nothing to memorize, but really good list of, what to be aware of, what might survivors be experiencing. And we see this. If you go through this list and you're following the media when there's a disaster unfolding, all of these, they may not all happen in one disaster, but I've gone through this list, and at certain times with certain different disasters, I've seen all of this. Okay, 14.6. Who are the populations at greatest risk for disruption after a disaster? Think about it. Let's say an impending hurricane. Okay, who do we try and focus on? Disabled, elderly, visually or hearing impaired, healthcare providers and first responders. I highlighted children because I think of, what about schools? What if something's happening during the school day? Right? What if something's happening before school or after school and kids are in daycare? Okay. You got to be able to think of them as well. So this is I like this chapter. I mean, depending on what your involvement is with anything in your community with disaster, this is just an excellent chapter to look at. Not even, for this class, fine, but just in general for, becoming a nurse and knowing what your potential, you'll be involved. If you work in a hospital, you'll be involved. You'll have a role in disaster management in a hospital, in a clinic, in the community. So really good chapter to take a look at. All right, so let's figure out our levels of prevention related to disaster management. Primary, participate in developing a disaster management plan for the community. Why is this primary?
It's giving education on what you should do before the disaster even happens.
Yep, it's coming up with a plan. Right? Nothing's happened yet, but we're coming up with a plan, and then we're trying to educate whomever this disaster plan is for. Is it for your hospital employees? Is it for your workplace? Is it for wherever your workplace is? Okay, secondary, assess disaster victims and triage for care. Why is that secondary? What are we doing?
Taking care of people that have become had problems from what happened.
Yeah, you're trying to assess, you're trying to identify and triage people that can be helped, right? You're trying to prevent further damage, further carnage. Okay, and that's why we do triage. Okay, so you're screening. You could use the word screening here. You're screening victims, triaging them for who can be helped and maybe who cannot be helped. Okay, and then tertiary. Why is this tertiary? Participate in home visits to uncover dangers that may cause additional injury to victims or cause other problems. Why is that tertiary?
Because you're treating.
What are you treating? What's already happened? What's already happened?
The disaster.
Correct. So we may be asked to visit homes to assess for any potential further problems. House fires from faulty wiring. That's the example they give here, right? The disaster's already happened, but we may be participating in further assessment to prevent further damage. Does that make sense? Okay. Anybody have any questions on disaster management? Okay, time. I think we might have time for one more chapter, and then you're gonna have to do exactly what we're doing. This is what I would expect you exactly what to do. Go through the PowerPoint. Oh, the one thing I wanted to show you was in our study guide, there's a whole section on disaster management. We're going to cover this now. Actually, what I should do for this chapter is go right to the study guide, because this is what we need to know to be able to understand the importance of what we have to do to participate in surveillance, observation and surveillance with outbreaks. This is what we need to know. So I would have just gone to the book and gone through all of these, but I think for this chapter, we'll just review the study guide. Okay. Take that back. We're going to do one thing first. We're going to do the PowerPoint. We won't go to the book, but we'll go to the PowerPoint. All right. And then we'll go to the study guide. Okay. So we know that disease surveillance has been part of the public health protection since the 1200s. Okay. Constitution provides powers necessary to preserve health and safety, as well as other events. Okay. And one of these very important powers is public health surveillance. Okay. What have we been doing? What have we been surveilling for the last 2 years?
COVID.
COVID.
Yep. Right. We have been surveilling it. Right. And we have been looking at outbreaks. That's all we've been doing for 2 years with COVID. Right. Okay. Definitions of importance. What is disease surveillance? What is the event? How do we surveil biological terrorism, chemical terrorism? Okay, so public health surveillance can be used to facilitate the following. I want you to read through that. You can estimate the magnitude of the problem, determine what the geographic location or distribution of the illness is, right? Detect, is it epidemic? Is it a pandemic? Is it endemic? All right, monitor any changes, detect changes, facilitate planning. What are the purposes of surveillance? I mean, think about it. You probably don't think of surveillance all the time when you're doing things, but think of the importance of surveillance in public health. Think of the importance of surveilling COVID over the last 2 years. Think about the importance of surveilling a pertussis outbreak in a school. All right, think of the importance of surveilling a foodborne outbreak from a restaurant. That's what surveillance is. Okay, just trying to simplify it for you, right? And obviously surveilling is going to involve a collaboration among partners. Let's say we have an outbreak of pertussis in schools. Who are we going to have to communicate with? The health department, the parents, the school personnel, the teacher. What if we have a foodborne outbreak at a restaurant? Who do we coordinate with? I don't know, maybe the emergency departments, local emergency departments, to see if they've had patients with food poisoning symptoms there. We'll have to communicate with the restaurant, the employees, how they prepare things. Okay, with COVID, who are we collaborating with? Let's say there's a COVID outbreak in a school or a assisted living facility, right? Who do we have to coordinate with? The health department, the infectious disease nurse, the patients, their families. In the schools, who's been identified as positive, who's vaccinated, who's not, who needs to be isolated, on and on. Okay. Right? What are some competencies the nurses have to have when we're talking about surveillance monitoring, outbreak monitoring? Here's some of our core competencies, right? We need to be able to analyze data, be able to communicate, have good leadership skills, because you're probably going to be leading that charge. Right? What are data sources? How do we get data to complete our surveillance tasks? Right? Do we go for birth certificates, death certificates, administrative data, cases reported by school nurses or doctors? Okay. Each state, well, there's a federal guideline of reportable diseases, and then that filters down to the state, and the states have their guidelines for reportable diseases, and then maybe localities take that a step further. I know when I worked in our big county, we had an additional list of reportable diseases from our county. So if you're working in community health, which is what a school nurse is, community health nurse, you have to be aware of that. And then what are some types of surveillance systems? That's on the study guide. Okay, we'll go through that. And then defining the magnitude of the problem. Is it endemic? Is it hyperendemic? Is it epidemic, pandemic? Is it an outbreak? Just knowing that there are many different definitions of what you can find in an investigation. I don't need you to memorize those, but we do need to know the patterns of occurrence. How did it occur? Was it a common source? We'll go through those. Common source is, let's say, everybody's been exposed to something and everybody gets sick. So the example they use in the book is, a gas being released on a train. Common source. Is it a point source? Is it a mixed outbreak? I'll show you on the study guide, we have those definitions. Okay, so let's jump to the study guide for that. This is what I went through with the group yesterday. All right, we just went through this. What is surveillance outbreak? Observation and surveillance is the process of systemic collection of data, analysis, interpretation, dissemination to monitor disease trends. So that's your, right here, that first sentence, that's your ADPI. Looks different. It doesn't have assessment, planning, assessment, diagnosis, planning in those exact words, but this is transitioning your thinking of what the nursing process looks like with surveillance outbreaks and surveillance monitoring. Okay, you have to collect data, analyze it, interpret it. What's your plan? And monitor trends. Okay, here's your systems. All right, so you have a passive system, an active system, a Sentinel system, and Centauromic system. So for example, I, in school nursing, I participate in the passive system where I am a healthcare provider to report any existing cases. Okay, so once I do that, let's say in an active system, then the health department takes that on. Let's say I report a case of pertussis in my schools. All right, they're relying healthcare providers to report any existing cases. Well, when you take that a step further to the active system, then the health department picks up the responsibility and they may search for additional cases, like maybe contacting hospitals or physicians' offices to see if they have any reported cases of pertussis within that group. Okay, and then you have the Sentinel and Centauromic system. And then what are your patterns of occurrence? Right, we just talked about this. Point source. Okay, point source outbreak occurs when all persons are exposed to the source, resulting in each person getting ill. Okay, what's an intermittent outbreak? Right, it's intermittent, refers to the exposure over a period of time when people might get sick at different times. And the example here is food poisoning. Okay, so, let's say there's a bad batch of chicken at a restaurant and it's served over 3 days. Okay, people get exposed to it over 3 days and people get sick at different times. Okay, mixed outbreak occurs when a person is exposed to a source and then person to person contact spreads. And that would be example would be the flu. Okay. Make sense? So I need you to go through these. So when we're trying to develop community-based programs on surveillance, we need to be able to conduct a needs assessment. Okay. And there are 4 stages of the needs assessment. And there I've highlighted them: preactive, reactive, inactive, and interactive. Okay. So you need to review those. Okay, and then the last part of this section are different models in program planning that focuses on certain things. So for example, the patch model focuses on mobilizing the community. You want the community to participate. You want to collect data from the community, choosing health priorities, developing comprehensive plan. The patch model, you want to include the community in. Okay, and then you have the APE, Assessment Protocol for Excellence in Public Health. In the book, you have the acronym. That's like the APEPH. Okay, this model focuses on assessing and settling priorities for health problems. And then the third model, it's called the MAP, the MAPP, Mobilizing for Action Through Planning and Partnership. Right? And this model develops a framework for long-range planning. This is all part of surveillance and observation. Okay. Questions on that? So that's your surveillance and outbreak. So there's 2 more chapters that I'm going to ask you guys to go through the process we're going through, because it's 251 and I want to do the attestation questions. So the last 2 chapters we have are managing quality and safety and nursing practice at the local, state, and national levels. Okay. And if you look on here's chapter 28 here. Okay, government, the law, and policy activism. This is chapter 28. So this is what I want you to review for chapter 28. Okay. And then managing quality and safety. Okay, there's your case management. Surveillance outbreaks we just went through. Managing quality and safety. Okay. So here's your managing quality and safety. So what I would do is take these two sections in the study guide. This is what we need to know. This information would be what I call key essential knowledge to understanding how we manage quality and safety. Okay. We went through ethics. We went through cultural influences, immigrants, refugees. Here's a sample of your setups for math calculations. Case management we talked about. That's going to be chapter 28. Disaster management. Okay, so by going through the study guide, most, if not all of it, other than your legwork you're going to have to do in chapter 27, 28, this information should be familiar to you. You are going to have to do some more research if you're not understanding the topic. And that research goes back to the study guide, or excuse me, the chapters, the PowerPoint. If it's levels of prevention, maybe the Kahoot. If it's AdPi issues, maybe your AdPi Kahoot. And then after this class, when I send you out the recording of our class, I'm going to send out the week 8 Kahoots, which is a combination of all, I think there's 40 questions and it covers all 8 chapters. So you got lots of resources. If everybody could pull up their attestation, that'd be great. How are you guys? What are you guys thinking? Give me your assessment, feedback from today. Helpful? Too much information, too little information? What are you guys thinking? I can only see 2
It
people.
was helpful.
Everybody has their cameras off, so I can only see 2 people. So feedback is helpful.
Yes, helpful.
I feel like it was an adequate amount of information in one day.
Adequate or inadequate?
Like a good amount.
Okay, all right. And we still didn't cover 2 chapters, so okay. So first question, what's our first question in attestation? I should know this from yesterday. Oh, human. Does everybody have their attestation pulled up? It's what are the 2 types of disasters? What's the answer?
Natural and man-made.
And give an example of one. Give an example of each one.
Natural is a disaster caused by natural forces like a earthquake.
Yep.
Man-made is more like wars or fire accidents.
Thanks, Helen. Yep. Anybody want to add to what Helen said? And then the second question, I think, is about your, what is the site? It's about ethical, is it theories or principles? It's asking for.
It's
Anybody?
the ethical principles.
Okay, and so who wants to help your teammates out with what your 4 ethical principles are? They were right in a box in the ethics chapter. And I believe they are anybody
Was
wanna-
it respect for autonomy, non-maleficence,
malfeasance? Yep.
yeah, beneficence, and distributive justice.
Everybody get that? You want to repeat that?
I'll try. I can't never get that word right, but
that's
respect
okay.
for anatomy, non-malafeasance, yeah.
Non-malfeasance.
malfeasance, beneficence, and distributive justice.
Okay, let's talk about real quick. What's autonomy? What's that principle? What are you trying to accomplish with that?
Like if I see it in a sentence, I could probably explain it better, I feel.
That is a right to make your own decisions.
Yep. So if you're working with a client, how does that work? You're working to try and help the client be as autonomous as possible and participating in their own decisions. Correct?
So like promoting independence.
Correct. Okay, what's beneficence? Or excuse me, what's non-malfeasance?
Is that like not allowing
Do no
client to
harm.
participate?
Do no harm. Do no harm. What's distributive justice? Look back at the box in the book. What's distributive justice? I want you to understand these four before we leave.
It requires that there be a fair distribution of the benefits and burdens in society based on the needs and I can't read that word.
Spell it.
Something of its members.
Okay. Distributive justice, distribution of resources. Okay. And what's the fourth one?
Beneficence.
Okay. What's beneficence? If non-malfeasance is do no harm, what's beneficence?
Doing good. Is that
Doing
what
good.
it is?
Doing good. Yep. Okay, friends, that is it for today. So going forward, let me give you the plan. So after today, you're going to work on chapter 17 and 28 with this, hopefully with the same process we're doing with all the other chapters. Today marks the last bit of content for lecture. Okay, so next week is exam week. Well, take a step back. The end of the week is reviews. Okay, so after you've attended your reviews, you have your to-do list for me of what you need to do as far as putting everything together for exam 3. If after you put everything together and made a truly honest attempt to review all your resources, I'm going to put out some times over the weekend, probably on Sunday and Monday, because we're still doing reviews Saturday and Sunday. So probably Sunday and Monday for individual times for some tutoring. Okay, I'm probably I don't know how many requests I'm gonna have, probably quite a bit. I'm gonna probably do them in 30-minute increments so I can fit in everybody that wants to do it. But remember, I need you to do your part in coming prepared on what specifically you need tutoring on. Okay, so next week we'll do exams. Okay, so that's week 9. Week 10, we'll spend our lecture time doing 2 hours of HESI review. Okay, I believe the requirement is going to be that, I think we did this last term, you do need to come to your scheduled lecture that week. So you'll be doing a HESI review with me. However, I believe we're going to provide a list to you of all the other sections that are also offered that week. So it's everybody's regular lecture. So for example, Dr. Lundy has 4 classes, Professor Price has 2, and we'll give you the opportunity to pop into any one of those other lectures at all during the week. Does that make sense? So there's no additional reviews, but I think we have between us, I think we have 12 sections for, I don't know. Yeah, I think we have 12 sections because 4 of us teach 2 classes, that's 8, and so there's 12 sections. So you have lots of opportunities to pop in on any other professor's lecture, but you do, for attendance purposes, have to attend your own. So that's week 10, it'll be all HESI. Okay. And then week 11 is your HESI and your remediation. So we're getting into the home stretch here. Anybody have any questions or comments or concerns? Or if most of you are taking your HESIs on campus, from my understanding from these at-risk meetings I'm attending this week, those are all in the planning process now. Okay, your deans are preparing the schedule. Some of you may already know them. If you have any scheduling issues, you need to go back to your campus dean. Okay, I'm just going to stop the recording here.